This is an analysis of Maryland OB-GYNs to give an in-depth look on sentiment analysis and minute surveys. This is intended for managers to be used as an operational tool and thus focuses on the concept and application of sentiment analysis and minute surveys. The physicians' names in this presentation have been removed to support this objective. Further sentiment analysis videos can be made that are intended for patients and should include the physicians' names at that point. Doing so would allow for transparency and could assist the patients in choosing an OB-GYN.
I was devastated, absolutely devastated.
The hospital has since apologised, but Sally says this sums up the lack of care her dad received at North Manchester General. She says the letter was the final insult.
It's hard enough to lose a loved one.
Mr Johnson had been diagnosed with cancer 6 years ago, but his family say the hospital failed to give him pain-relieving drugs. His bedsheets were left stained with urine and his appetite waned as his weight dropped to just 8 stone.
He went off food completely. He wasn't put on a drip.
Physicians, especially those who cared for the deceased patient as seen in the preceding video, may find it in their best professional interest to understand why their services are viewed as either positive or negative. Physicians may also be interested in how they compare amongst other physicians in the same area. These objectives can be accomplished through the use of sentiment analysis. When conducting serious research or making everyday decisions, we often look for other people's opinions. With the availability and popularity of opinion-rich resources such as online review sites and personal blogs, we can use information technologies to seek out and understand the opinions of others, to translate human emotion into hard data. Sentiment analysis deals with the computational treatment of opinion, sentiment, and subjectivity in text, and classifies it into categories like positive or negative. A sentiment application would be identifying what patients are saying about their doctors, or tracking what internet bloggers are saying about a brand like Apple. It can be seen then why sentiment analysis is also referred to as opinion mining or the voice of the customer. Sentiment analysis can be applied to minute surveys. The minute survey is a standardized form that can be used to assess patient satisfaction with their care in various health delivery settings: hospitals, inpatient and outpatient visits, doctors' clinics, and home health. The minute survey asks 2 questions to evaluate patient satisfaction. The first question is the quantitative analysis, as it asks patients to rate their overall satisfaction with their care on a scale of 1 to 5. The second question is the qualitative analysis, as it asks patients to explain what worked well and what needs improvement. This is an example of the minute survey's quantitative analysis for a specific physician, Dr. 3. Patients are administered a survey and they rank the physician's performance between the numbers 1 through 5. 1 being the lowest performance and 5 being the highest performance. Any scores that fall below 4 are classified as a complaint. Based on the quantitative analysis for Dr. 3, many of the complaints are focused on the doctor's punctuality with 4 complaints, followed by helpfulness and then knowledge. This control chart displays Dr. 3's performance ratings from the first comment to the most recent comment. For this control chart, we used the numerical ratings from the minute survey and computed the average, the upper limit, and the lower limit. The resulting control chart can help monitor Dr. 3's process variation over time and to communicate process performance. As you can see, Dr. 3 has had a fairly consistent record of positive numerical ratings ranging between 4 to 5. However, Dr. 3's recent performance has been random and thus is not in statistical control. This can indicate that her performance has declined or that patient satisfaction has declined. This is an example of the minute survey's qualitative analysis. Patients are asked to comment about their experience after finishing the quantitative survey. Once the survey is complete, a comprehensive analysis can be performed to look at both the numbers from the quantitative analysis and the operative words from the qualitative analysis. This is a representation of all Maryland physicians specializing in obstetrics and gynecology. You will notice the name of the physician followed by the date of the first and last complaint or praise, as well as the number of complaints, daily probability of complaints, and the days until the next complaint. Dr. 3 is highlighted because this physician is compared with the other 128 physicians with over 4 comments. The entries with 0 represent those with no recorded complaints. therefore making it difficult to predict the days until the next complaint. From this, the sentiment analysis identified two things for the physician: the predicted days until the next complaint and how to improve. The minute survey uses time to dissatisfied patients. Rather than solely assessing patients' input through standardized satisfaction surveys, patient complaints should be examined for performance improvement opportunities. Whereas satisfaction ratings are usually not related to the technical quality of care, patient complaints are more closely related to the technical quality of care. Also, complaint data are available at a fraction of the cost of conducting satisfaction surveys. These gains would allow organizations to focus less on data collection and more on improving care processes. This is a representation of the predicted number of days until a physician receives their next complaint. As you can see, the categories are broken down into good, average, and poor categories, which represent the number of days until the predicted next complaint. The higher the amount of days, the better the physician is ranked. In this example, Dr. 3 is in the poor category under subgroup 3 because the calculations predicted 330 days until the next complaint. Dr. 3 comprises 13% of the population of Maryland OB-GYNs. Those doctors with predictions that are non-applicable have been excluded from the graph. Let's take a closer look at Dr. 3's ratings. This is an example of a qualitative analysis from one of the ratings. With this, we can pull the keywords and analyze whether the comment is a praise, complaint, both, or neither. When highlighted, it is apparent that this comment is both a praise and a complaint. The highlighted box of operative words allows the reader to easily classify whether the comment is negative or positive, and the additional classified as boxes clearly categorize the comment. For instance, this comment has words such as blessing, individualized care, and helpful, which are positive words. Conversely, the phrase, office staff is another story, has a negative context. Based on this analysis, the physician can group praises and complaints into a chart to clearly identify what needs to be improved. This is a visual compilation of Dr. 3's praises and complaints. With this, Dr. 3 can see what needs to be improved in his or her practice. For example, we see that most of the comments are praise given to the doctor for various reasons, under the other physician NP related, whereas the complaints are distributed equally among physician advice, physician taking enough time, staff-related issues, and time in the exam room. Most satisfaction surveys gather data on components of satisfaction. Such surveys such as the HCAHPS, the Patient Satisfaction Questionnaire, and the Patient Judgment of Hospital Quality Questionnaire differ on which components of care they measure. These surveys specifically ask for source of dissatisfaction by attributing the dissatisfaction to specific provider groups, physician or nurse, or to specific care processes, admission process, or laboratory services. Statistical analysis is then conducted to identify the dimensions of patient dissatisfaction ratings. The minute survey reduces the number of questions to only 2 and does not specifically collect any information on sources of and components of dissatisfaction. This is the fundamental idea of minute surveys, to ask the bare minimum necessary for analysis of time to dissatisfied patients. By utilizing a shorter survey form and surveying fewer patients, the burden of the survey would be reduced, the response rate would be improved, and the cost of collecting patient satisfaction information can be reduced. A short, low-cost, efficient survey tool can propel organizations to focus less on data collection and more on improving care processes.